Good evening. My name is DeAndrea Billings, and I have developed a PowerPoint presentation for our case managers and our service coordinators for their transition from a full-time in the office role to a full-time remote status. So we are basically developing this project to ensure that we have a smooth transition home from work and to ensure that we maintain quality of care throughout the transition. This presentation is titled Guidance for Working from Home. It's developed to maintain productivity and safety while working in a remote status. So the objectives of this course are to explain the definition and the meaning of working from home, to provide staff safety instructions while in a work from home status. We also are going to provide desktop and telecom equipment and security for our staff to work from home. We will describe the roles and responsibilities. I will also describe preceptor requirements while working from home. We'll discuss departmental standards and expectations while in a work from home status. I'll explain the role of self-accountability. I'll explain the process for requesting paid time off and explain the importance of effective communication with their supervisors and managers while in a remote status. So you may be asking, what is the purpose? The purpose of this course is to provide guidance to our staff that are in a work from home status to maintain staff safety. We want to maintain required equipment and security. It is important that we uphold Children's Health Plan standards as outlined by our state contract. We want to understand departmental roles and expectations. We want to maintain the members' quality of care. That's what's very, very vital during this transition. We want to eliminate any potential concerns or issues while in a work from home status. As a service coordinator, you are responsible for providing effective, equitable, understandable, and respectful quality of care. The standards of care must be maintained while in a work from home status. And basically, the overall goal of this presentation is to ensure staff are safe and have required education in preparation to transition to a full-time work from home status. All personnel must be able to perform their job effectively while maintaining productivity and quality of care. So what does it mean to you when someone says work from home? The definition of working from home is to do one's job in one's house and not in an office building. Working from home can also mean working while traveling or telecommuting. It must be approved by your supervisor and or your director, and working from home it is a privilege. We are allowed to work from home. It is not automatic. It's something that you've earned. And you have to maintain your quality of care for the members in order for you to continue to work in that status. So first, let's go over staff safety. Let's go over the work guidelines. We need to always ensure that there's a separate work space. You want to have your own office. We want to avoid places that are too hot, too cold, or damp. Ensure that there's adequate air movement within the room. Check the area for a smoke detector. You want to make sure that your room is safe. Check all the electrical circuits to make sure that they're assessed for power. We have to be able to accommodate for the telecom and desktop equipment. Do not hold household extensions. Do not use, household extensions. We always want to make sure we have a surge protector that we use to plug up all the telecom and desktop equipment too. Place cord safety to prevent a trip or fall hazard. So do not have cords across the room laying on the floor. We want to make sure that they're hidden and they're out of the way and you're not tripping over them. Next, let's discuss the lighting requirements. Normal room lighting should be adequate for visual comfort. So You want to make sure you have a white light. You don't want any fluorescent lights, fluorescent lamps. You want to make sure that it's almost like a natural light. Reduce the amount of light directly on your computer screen because that may cause it to be difficult to view. Place the computer screen perpendicular to the outside light or use shades or blinds. You do not want the sun shining directly on your computer screen. Task light can be used for additional lighting, so you can always get a desk lamp that's made for computers so that you can see your computer and visualize everything you need to on the screen. Work surfaces. Minimum dimensions, according to my literature review, you want to make sure you have a work surface of 48 inches long and approximately 30 inches deep. You want to have enough equipment and have support for your equipment. You want to make sure that you have it at an adjustable height from 24 to 28 inches. Non-adjustable surfaces should be around 26 or 27 inches. And while seated, you want to make sure that your elbows are even with your home row of keys on the keyboard. And you want to avoid hyperextending or hyperflexing your wrist. You want to have a supportive chair. You want to make sure your chair has back support. You want to make sure that there's a back support in the arch. You want your shoulders to always be relaxed and in a neutral alignment position. Upper arms should be near or at the side of the body. Your forearms should be parallel to the floor, and your wrist should always be in that neutral position. Your wrist should not touch or contact the surface edge when you're using the mouse or the keyboard. Okay, if you look at the slide, can you tell me what problem you identify with this picture? Yes, that's correct. She does not have a desk. The computer is sitting on her lap, and her home keys, she just basically has her wrist. They're not where her home keys are. And that is not a comfortable work environment. It appears that she's maybe even sitting on the floor. So we want to make sure that you have a desk, and that you have a chair, and that you have a comfortable position to work in. Here's the next picture. What do you see that may be a problem with this photo? Okay, yes, you can't see the entire photo, but it appears that this person is sitting in a bed. They have their glasses, their cell phone, and it looks like a cup with some supplies in it, and their laptop. And it appears that they have their legs crossed, and that is also not adequate for a work from home space. Is there anything wrong with this photo? Can you identify any issues here? Okay, for a majority of you all would say there's nothing wrong. And the only thing that I notice is that it looks as if she's at a table or a desk that she's working with, and that her wrists are laying on the table. Her right wrist is laying on the table, and it's kind of like hyperextending her hand over the keyboard. And then her left arm appears like it's sitting on a book. So that is not the most comfortable position, but she is at a table and she has some coffee to keep her alert. What is possibly wrong with this photo? That's correct. The baby or infant is lying next to the mother. The mother's back is against a pole and she's sitting on the floor. And this is not a safe working environment. It does not look comfortable for the baby or the mother. It appears that she has a makeshift desk that is made for someone to work from on the floor. It does not appear to be a healthy, safe work environment. And here we have the baby working at the computer, and the mother is not getting any work done. So basically, she is not accomplishing her work for the day. And we love children, we love our children, we love our pets. However, while you're working from home, it's not the time to have your child in your lap. It's not the time to have your pet in your lap. We have to be focused, and we have to ensure that we're taking care of our members. So the desktop and telecom requirements that you'll need is a wired desktop or wireless laptop. You'll need a docking station, a monitor or keyboard, a headset, a soft phone, and an important note is that you must contact IT to set up your soft phone after you receive it. So some equipment that is not approved are scanners. Mobile scanners are provided for travel for case managers, and no printers will be available or fax machines. So fax machines and printers are not available. The scanners, only the mobile scanners, and that's only for the authorized case managers. Monitors should be positioned in approximately 20 to 26 inches from a person's eyes. You want to avoid being too close to your computer screen. There are special glasses, if you do wear glasses, that block, blue blockers they call, that are specially made for high utilization of computers. You want to ensure that top of the screen is slightly below eye level, and also the keyboard must be placed directly in front of you. And all your supplies should be in a comfortable area of reach. Document holders should be placed at the same height and distance as the monitor. So identify the pros and cons of this workstation. So it appears they have a nice ergonomic chair. It looks quite comfortable. It appears that the monitor is at the correct level and that the keyboard is in the proper location. They have a mouse and a mouse pad. It also looks like they have document holders that are located slightly above the monitor, which is good. And then they have the fax machine is a bit high because they would have to reach in order to get the faxes or to send the fax. However, for the most part, it is a good area for working in a remote status. They have that natural light coming through the window, which makes it look very comfortable, as well as the light that's built into the desk. So let's talk about body mechanics. We want to ensure that our shoulders and hips and ears are vertically aligned. Make sure that the chair back has support, that the arch in the lower lumbar has support. We want to ensure that the shoulders are relaxed and in a neutral position. Use your upper arms. They should be near our side of the body. And make sure that your forearms are parallel to the floor and that your wrists are always in a neutral position. Your forearms and wrists should not contact the work surface edge when using the mouse or the keyboard. So what is the service coordinator's role? The service coordinator's role during a work from home status is to maintain member outreach. So we want to make sure that we're calling our members and that we're following up with our members. We want to ensure continuity of care, that there's no break in our members' care. We want to follow up with their providers and ensuring that they're receiving the medical necessary services. The goal is to also monitor and maintain important timelines. So we have to submit SAIs on time, upload ISPs on time. We want to update any ISPs, and we want to follow up call for any discharges that occur, so that we can follow up and ensure that the member is getting any follow-up care or being referred to any specialists that need to see after discharge. It is important to see STAR Kids timelines for a complete list. We want you to review those so that you are aware of what needs to be done and when it should be completed. In additional, the service coordinator are required to fax personal care service authorizations to the primary care provider, scheduling member telephone screenings. They have to provide resources for our members and their legal authorized representative within 7 business days. We want to make sure our service coordinators and case managers are consulting with the provider within 1 business day of the request, and discharge follow-up should be conducted within 1 business day of the request. There's a caseload spreadsheet which will always be maintained and updated by the service coordinator, and documentation is necessary to maintain continuity of the member's care. If it isn't documented in Tapestry, it didn't happen. It's very, very, very important that we're documenting all of our outreach and follow up with our members. So a typical workday for a service coordinator here in the office would be a combination of the following visits or calls. 2 SAIs, 4 telephonic or teleconference visits, and a minimum of 8 telephonic contacts per day. Another example would be 2 scheduled or completed SAIs, 1 SAI and 2 face-to-face, 2 teleconference visits, and 4 telephonic contacts would also suffice for a workday. And basically, while you're working from home, we would want you to continue to be able to meet the expectations. If there's something that's preventing you from completing these tasks, if you're not able to get online, or if you're having access issues, we would rather you come into the office to ensure that you can still get your work completed and your task completed on time. So there's information that is required for documentations. Whenever you contact one of the members or their parents, you want to make sure we're getting the person that was contacted. We need their telephone number. We need to know their name. We need to know the detailed discussion that occurred, so there should be detailed notes, and the response to the call. What was your response to the member's parents or to the member regarding the call? And what is your plan going forward? The supervisor's role is to basically make sure aftercare discharge follow-ups are being done for our behavioral health members, and that they're being assigned to the appropriate team. We want to support staff with questions and answers to their concerns. We have to ensure that we're reviewing Chronos request and SharePoint calendars to make sure that your calendars are being maintained, they're up to date, and then all the requests that are being submitted, whether it's for bereavement, PTO, FMLA, that those are being reviewed and approved at the appropriate time. Also, additional administrative duties are forms and mileage reimbursement. So those have to be reviewed daily, and approval of the team members' attendance to conferences or seminars have to be reviewed. Any reports past due SAIs, review of individual caseloads from master reports, and then review and assignments of any pending cases. And those have to be done daily. Onboarding the new team members, the supervisor has to ensure that's continuing to be processed. At the current time, any new team members are required to be on board for 3 months before they can actually work off site. So it'd be vital for the supervisors to be there or have someone on site with that member the new team member who's onboarding, and that way they can provide adequate training during that time frame. The supervisor are also responsible to have team meetings. They have to have the one-on-one meetings, and also pace meetings to check their annual pace to ensure that they're maintaining their 80% or higher on their evaluations. Caseload changes need to be reviewed. Any issues or concerns that are being escalated need to be reviewed. Their hearings have to be reviewed. We have to review those with the medical director. And also special projects. We want to be responsible for any special projects provided by our manager or our director. The supervisors also have to audit through service level audit tools, one-on-one meetings, monthly audits if the team members perform it at 70% or less, bi-monthly audits if the team members performing between 71 and 90%, and quarterly audits are for members who are performing at a 90% or higher. The goal is for everyone to be performing at 80% or above. However, if it's less than 80%, then a corrective action report may need to be done to identify ways to improve that staff members' success. The supervisor will also collaborate with the team member to develop a plan of action for any identified deficiency. So the supervisor and manager will determine if the team member requires additional guidance or support. Site visits may also be conducted by the supervisor during this established work hours if deemed necessary. I was talking to my director just yesterday, and she was explaining that directors have done site visits when members were not working from home, when they were supposed to be in a work from home status. They were actually in a different state, and they required that staff member to come immediately back to work, and they had to continue to work in the office for the remaining time period. So it's vital that we are maintaining responsibility for ourselves, and that we are working when we're supposed to be working in a remote status from home. So the online report time. Online report time is the same as if you were reporting into the office. You must be online at 8 o'clock, not 8:05, not 8:15, not 8:30. 8 o'clock is the time that you must report in. If you're not able to log in at that time, then please, by all means, notify your supervisor and let them know what the circumstances are for the delay. If the internet is down or you're having any type of computer access concerns or problems, or technical issues, notify the supervisor. And as noted previously, you may have to come in the office if the computer's going to be down for greater than 2 hours. Maintain your regular work schedule. If your supervisor has made a different work schedule for you, that's perfectly fine as long as it's authorized by your supervisor. However, you should be working from 8 to 5 Monday through Friday. Those are the regular scheduled hours. So documentation requirements. Documented in the case management application Tapestry. It's our new database, our new system that we started just last month in September. 2 months now in September. So basically our Tapestry system will be documenting all of our notes in. You will document all contact, any attempted contact, appointment cancellations. We have to provide detailed notes on any type of appointment cancellations. We have to keep the calendar up to date. The calendar must be updated with the daily schedule and inform the supervisor of any issues, concerns, or delays that may occur on your part. especially in a remote status. We want to keep the communication lines open and make sure that you are aware and that we're aware if something is wrong. All contact with our members, with the patients, must be done within 1 business day. So, what are our standards for work from home, you may ask? The main standards are to log in on time, log in at 8 o'clock, maintain effective communication, update your calendar to reflect daily schedules, monitor caseloads and timeliness, provide timely response to inquiries, maintain productivity at all times, maintain quality of care at all times, because that's basically our job, is to maintain the quality of care. So some of the department expectations are for the team members are they're expected to work the regular schedule unless they're otherwise directed by their manager or supervisor. All the employees are required to attend all meetings via conference call or in person or Zoom or Skype. All meetings must be attended. We want you to take regularly scheduled breaks and meal periods. If you're working from home, still take a lunch break. I know a lot of people that work from home will not take a lunch break. They will just grab a snack and continue to work. But it's still very important that you get regular scheduled breaks and that you do take a lunch break while working from home so that you can maintain productivity. Notify Cook Children's Health Plan. If you're injured and the injury occurs during work hours from 8 to 5, Monday through Friday, please notify your supervisor of that injury. Working from home is not a substitute for childcare. It is not. Modifications or arrangements for childcare needs to be made. Just because you're at home does not mean that you can stay home and take care of your child while working a full-time job. Your salary stays the same as if you're working in the office, an office location, so the productivity and expectations will remain the same while you're in the remote status. Working from home is not a vacation. It's not a vacation. I know lots of us would like to go on vacation right now, especially due to COVID-19. We would love to be on a sunny beach, enjoying the sunshine, feeling the sunlight and fresh air. However, unfortunately, working from home is working from home. It is our job. It's what we're required and responsible for doing. So let's do our job. Let's be proficient. Let's make sure that we're taking care of our members. Let's make sure that we're taking care of each other. And let's do our job. And if there's something that potentially could get in the way of that, let's identify that and resolve any issues that we may have. Let's be proactive instead of reactive. As I mentioned before, let's be self-accountable. We want to check our equipment and our software to make sure it functions and that we can do our job. Maintain internet access at all times. If you're having any connectivity issues, report it to IT. And also contact your supervisor so that they're aware if you're not able to log in. Work a full schedule, Monday through Friday, 8 a.m. to 5 p.m. Maintain a strong performance and productivity. Your caseload should be managed effectively, just the same as if you were in the office. You want to monitor your inbox. Protect equipment and data from unauthorized disclosure. You will have HIPAA information on your computer. We need to make sure that you're maintaining patient privacy at home as if you were at work at all times. Always maintain patient privacy and secure information. We do not want any of our members' information being compromised. If you're unsure of a task or a requirement, ask for clarification. It is okay to ask questions. Contact your manager or supervisor. That's what they are there for. They are there to help you. So please, by all means, if you have a question or concern that has not been answered during this video, please contact your supervisor or your manager. Paid time off request. While you're in a remote status, your PTO requests that are done in Cronus does not change. You will still have to submit PTO requests through Kronos, and they will still have to be approved by your manager or your director. If there's emergency, please contact your supervisor and let them know of what the emergency is and what has occurred, so that that way they can be accountable for you. They can let someone know what has happened, and then you can enter your Kronos time off once the emergency has been resolved. However, please contact your manager. If you've had a family loss and you need to take bereavement time, please contact your supervisor or your director and put in your request in Kronos. Let them know that you've experienced a loss, and they will work with you. And PTO requests must be submitted, of course, for vacation, travel, or illness. If you get sick, please contact your supervisor and put in your PTO request. You are not required to tell them any specific details about your illness, because that is also your privacy that cannot be released or should not be released. That's up to you. That's personal information, your personal protected information. However, just contact them and let them know that you are ill or you're not feeling well, and submit your PTO. Managers will approve or disapprove your request depending on the type of request and your work schedule. So just make sure that you submit your PTO request as you would if you were in the office, and then they'll review them and approve them or disapprove them, depending on, like I said, the circumstances at work, what we are required to do, and what we are tasked with. So we just need to follow up and make sure that we are authorized that time off before we actually leave for vacation. But if it's an emergency, by all means, just contact your supervisor and they'll be more than happy to work with you. So for level 1 preceptor role, the level 1 preceptor, they're responsible for assisting with onboarding and general questions from the new team members, entering authorizations. They can answer general ISP questions. They can review training topics, update and maintain calendars, assist with other team members that require assistance. They can also have, they can shadow new or current employees with SIAs and face-to-face visits. Collaboration with level 2 and 3 preceptors for training and education. However, level 1 preceptors are not responsible for answering eligibility questions. Eligibility questions should not be going to level 1 preceptors. That can be done in member services. Provide coverage of members only when service coordinators are on leave, and do not respond to emails sent to supervisors, managers, or directors if copied. Level 1 preceptors should not be responding to emails. They should only be reviewing them, and a supervisor, manager, or director will respond. Let's go into effective communication. So the most important part of effective communication is ensuring that you're updating your calendar according to your schedule. Make sure that it's updated, and if changes are made, make sure your calendar is updated and reflects that change. To discuss performance questions or concerns, that can be done during the one-on-one with your supervisor. If you have difficulties or you're experiencing difficulties while working, please contact the director or supervisor and let them know. And then explain potential shortfalls or discrepancies that may be occurring while you're at work. Set realistic goals. If a task is time sensitive, we want to notify the supervisor or the director if we're not able to meet the timeline that has been set. And then let them know when it can be accomplished or completed by. If there's a specific task that is required, that it has a specific due date. We want to make sure that we're working on it and that we are keeping that communication open and letting them know why it is not completed. Does anyone have any questions or concerns? I don't have an email to leave you. However, if you could just make a comment in the reviews, I will respond to the comments. I really appreciate your time. It's been my pleasure. Thank you so much and have a wonderful day. These are our references. Thank you. What happens next? Oh, don't believe it. It took me a long time. Yeah, I know. I heard you talking away.
Did you stop the recording?